Hi, everyone, and welcome to the Femme Force podcast. My name is Rachel Paskvan, and I am your host. And today I'm so excited to be joined by Dr. Evelyn Higgins, who is a 35-year practitioner and pioneer in epigenetics and genomics for women's health, which I'm probably saying literally both of those wrong because I am not a scientist, but we're going to go over the whole thing. So she has been working in biomarker mapping to address issues like energy levels, emotional balance, mental health, and she has had a personal journey with her family's health and why understanding our genetic makeup is transformative, especially for women. So thank you so much for being here, Dr. Higgins. I really appreciate it.
It is absolutely my pleasure to have this conversation with you, Rachel.
So tell everyone kind of just the background of yourself, how you got into this, what your background is, and then we'll
Sure.
dive right in.
Sure. So practicing I don't even know what it is now, 36, 37 years in integrative pain management. And I was initially in a rural area
Mhm.
and saw kind of this haphazard way of trying to treat people. Well, we'll try this, we'll try that. If this doesn't work, we'll go to that. And I was seeing people become dependent on medications. Then, some 20 years after that, I'm in an urban area and I think, great, it's going to be different. We're going to have more resources. It's going to be more progressive thinking. It was the exact same. Nothing had changed. The only thing that had changed was I was seeing people go from dependency to addiction. And personally, I married a man who was an alcoholic, in reality, had several addictions. We had a daughter together. A year after our daughter was born, we found out that he was adopted. And I was seeing these mental health concerns in him, these addiction concerns in him, and saying, I know nothing of the genetics here. I know nothing of the family history. And I have a child. And as a parent, my job is to be that umbrella for my child. So I started kind of moving towards what can we learn, got a terminal degree, addictionology, compulsive disorders, and the science was evolving, technology was evolving. So I put myself into a place to start using that in to eventually wind up doing what we do. But the sad part is, Rachel, that in that space of behavioral wellness, of addiction, of even overall wellness, this was not being employed. The science was there, but we were just kind of like, well, we'll just keep on doing what we're doing, and nothing was really changing.
Yeah. I mean, and that makes so much sense, like knowing the background of, especially for women, like with all of the hormonal issues going on and like for adopted people and things like that. Like this is so important, like for specific health is, health information. And,
Absolutely.
what are some examples of how genomapping can identify, root causes of, common health issues?
Sure,
When we
sure. Well,
talked about low energy, depression, hormonal imbalance,
yeah,
all that.
yeah. Someone says, I don't know, maybe I think I'm depressed. I just can't get off the couch. I don't know what's going on with me. Well, we look at in our panel, we look at neuropsych genes and see, is it directly related to that? But more than that, Rachel, is it's related to so many other parts, right? It's hormonal. It's cortisol levels, our stress hormones. They affect our sex hormones. We look at genes related to mitochondria, that part of the cell that creates energy. So is that inability to get off the couch and kind of could care less about life? Is it what's happening with you're not creating enough energy? Or is it truly something related to a neuropsych gene? We look at inflammatory markers. That is going to exacerbate every condition that a human being has because we now know that the nervous system, the endocrine system, and the immunological system are all one super system.
Yeah.
Everything is not operating independently, but that's the way we treat people, as if it's all independent and here, take this, right? The big issue is that we're looking for a single molecule solution to a problem that's not a single molecule.
Yeah.
And we have over 8 billion different people in the world with 8 billion different sets of DNA. Yet we're treating everyone exactly the same. It doesn't make sense.
No, and I think that's the most interesting thing that like when we did our pre-talk about this entire thing is that just because we have the same organs or, we're humans and, all those fun facts, does everybody's an individual? Our literal fingerprints are
Right,
individual.
right.
So why wouldn't our medical treatment be individualized?
Absolutely. And when we talk about women's health, really, women are so um, just put in the it's your hormones. It's, you're just a moody person. You're, all the labels
You're
that go
stressed,
along
you're
with
all the
that.
things. You need more
Yeah,
sleep, drink more
it- it-
water.
exactly, exactly. Like, oh, okay. I'm not a stupid woman. I am intelligent. And I know that there's all these other parts, and it just kind of gets put to the side. And beyond not listened to, not even delving into the areas that should be of concern. Let's go back to like that depression issue. One of the genes that we look at will tell us if an SSRI is even going to be effective for you. So you look at the amount of people in general that are on SSRI meds or antidepressants. Rachel, the amount of people that come to us that have said, I've been on these things for 30 years, for 20 years. First off, they were never made for someone to live on them in perpetuity, right? They were made for an acute situation. Hey, you're going through something really tough right now. You're going to get past it, but I understand you need a little bit of help. Let's do this. Let's do it for 2 weeks. Decades? Never meant to be. But beyond that, we will then measure someone's neurotransmitter levels, their brain chemical levels. So we're talking factually, objectively, rather than sounds like, looks like, or you have a bad attitude, which is what women are told. So we actually measure and we will see with these people that's their serotonin is in the tank. So for 30 years, you've been taking this medication, and I'm not anti-pharmaceutical. It has a place. I am
1,000%. I love
anti-abuse.
popping a pill. I'm great
Right.
at
I am anti-abuse of pharmaceuticals, which is what we do,
yes.
right? So I was like, this serotonin, what you were taking never was going to affect that. Your liver, your bladder, your kidneys had to process this for 3 decades, and it was never going to work because no one took the deeper dive to see if you had that gene to begin with and was it going to be effective. And in fairness, 30 years ago, we couldn't look at that. It was only in 2015 that that part of what we do, the technology evolved enough so we could look at someone's genes. And, I did a TED talk understanding the biomarkers of addiction. And in that, I say that we all have strengths and we all have weaknesses within our genetic makeup.
Yeah.
Some people may think they have no genetic weaknesses. We all do. We're all human, right? But the issue becomes knowing what those weaknesses are and how do we address them? Just like when you're coaching someone, you look to their strengths and say, this is what you're really good at. Let's move you in this direction, right?
I mean, it's just so fascinating. And I really want to dive into like how does genome mapping work? Like what is the process? Are you giving a ton of blood? Are you laying down in a tube thing?
Sure,
Like
sure.
how does it work?
So it's really simple buccal swab, cheek swab,
Wow.
right? Yeah, simple. And we send it, we literally work with people all over the world. So we drop ship the lab kits to you, we get them back to our lab, we then get the information. We go over the biochemical pathways of each one of those genes to see, okay, is there any what we call a clinical correlation to it? Do we have any error in the coding? And if so, what do we need to do to optimize? So it is literally that simple.
I mean, that's amazing. Like
It is
that's all
amazing.
it is comparative to the, I go to an endocrinologist and I'm like, I don't have any blood left to give, guys. Like I'm like, you told me to fast. I don't know how well this is going to go, but like to be able to just do a swab and do it in your own home, also for people who are potentially uncomfortable with doctors or have fears,
Right.
needles, all of the things that come along with, medical care, to be able to do this where it's super simple and then you can get a really core idea of it,
Right.
just
Right.
phenomenal.
And then beyond that, once we have all that ready for the individual, we do like an hour and a half, 2 hour appointment to go over each one of those. So it's not just admiring, like a 23andMe. That's what I call a recreational test. What we do is a clinical test. You're just admiring, here's what I have. Well, that's kind of cool information, but useless at the same time, because what are we going to do to optimize? And that's the part to me that is so cool. That's where epigenetics is now at the forefront of all of this. And I really think that is the best part of science, because you're born with your DNA. Here's your cards, play them out. This is what you've got.
I mean, and it's just so interesting that like if we just understood specific genes, how we can help women manage emotions, improve
Right, right,
well-being, like optimize mental health, which is
right.
so tough. Like before we got on, I literally was like, I can't wait for this year to be over. It's
Yeah,
February 20th, guys. Like we're
yeah,
doing great, but like to optimize your mental health and especially in that era that we're in for like women like being like this is not good for me, like creating boundaries and like understanding all
yep,
that stuff.
yep, yep.
But to get a deeper dive because our therapists aren't able, to see how it's like
Correct.
mentally possibly
Correct. This
hurting.
is how it shows up in you, in your day-to-day personality, but what is behind it? So epigenetics, it's the same DNA, but we can change the expression. That to me is where the power lies, because it gives the power back to the individual.
Yeah.
Let's say a really tough situation. We were talking about you can't wait for this year to be over already, and we're only in February, right? So when we're looking at someone's genes, like one of the genes we look at is called the COMT gene, or the catecholamine methyltransferase gene. That is what allows someone to rapidly reverse anxiety and or depression, because it utilizes dopamine, epinephrine, norepinephrine. So when someone stays in that, like, man, I just, someone is saying to you, your friend is saying to you, get over it. You're like, I wish I could. I really wish I could, because
Yeah.
it's as painful and trying for me as it is for you to listen to it, right? That individual probably has an error in that gene.
And that's insane to think
And that
about.
can change.
Literally, it can change everything for them.
Right, right. And is, again, where I say on my disclaimer, I'm not anti-pharmaceutical, but we abuse it. Doesn't it make sense to look at that first before we put somebody on an anti-anxiety forever, to say, hey, we've got this gene. What are we going to do to change the expression of that gene, instead of take whatever for the rest of your life?
1,000%. And I know we talked in our pre-talk a lot about how this is just, it's so simple and it could solve so many problems for the billions of people globally in this
Yep.
world. And yet the accessibility to it is not like adopted yet. And the lack of insurance coverage is like a
Right,
huge issue. And I'm
right.
just baffled why we would gatekeep this kind of technology that could, save lives or prevent things, which you would think the insurance companies would want to do. Like if you know that you're possibly in a place to have, cancer and like you start getting the mammograms early and you catch it, that's less money they're spending on
Correct,
treatments and all of these
correct.
things. And it does like that doesn't make any sense to me.
It makes absolutely no sense. We look at a lot of inflammatory markers, and those are related to a lot of the different cancers, right? When you talk about the BRCA gene, when it first came out, that was not reimbursed by insurance. That was believe it or not, ladies, that was an out-of-pocket cost. You could say, how could that be? Because the insurance companies did not hang on to it and say, let's go with this. Unbelievable. It's the same with what we're doing right now. On a positive note, I can say that a very large insurance carrier reached out to us, which does not happen.
That's amazing.
Yeah, that's unbelievable. And they said, we know the efficacy of what you're doing. We want to run it in a pilot program. So then the other insurance companies say, hey, to compete with you, we've got to do this. Will it happen? I say yes. Is it going to happen tomorrow and next year? No, because all of these things take time, and you have the hierarchy of who has to say, yeah, it's okay, let's go ahead and do it. It's going to take years, but just like the BRCA gene took years. And at the end of it, yes, the insurance company saves money. Doesn't it make sense? Beyond that, though, should be the individual's life is actually
Valuable.
right.
And I think I've got a friend who's stage 3 breast cancer, and she got diagnosed at 32. She's obviously not able to get mammograms until after she's 40. So if she didn't do the self-exam on herself, she wouldn't have caught this. Like, she's doing radiation now. Shout out to Jess. She's amazing and strong and like the most phenomenal human I know. But she did the BRCA test. She came back negative, and like she still ended up with this. And it's just like, could genome mapping could have helped? Like,
Right.
could it
Right.
have seen like the bigger picture of this stuff and how this is going to work?
Yep.
And, prevented her at 32 from going through this really traumatic experience. And
Right.
the fact that like mammograms aren't available, and it's getting younger and younger and younger.
Hmm.
Like, the cancer is getting younger and younger. It's not 60-year-old women and 50, I mean, it is, but
Right.
like it's
Right.
20-year-old women and
Right.
their 30s. And I'm like, I don't, what is in the water that we are
Right.
all
Yeah.
drinking?
Yeah. Yeah. It is the environmental influence because it used to be the 60s, now when you're seeing it 20s and 30s, like, whoa, time out, all of this. But into that example, Rachel, a patient that we had come to us, she is her mid 30s. Her mom died from breast cancer in her early 30s. And her results in the inflammatory markers lit up like a Christmas tree.
I can like,
And she had her sister do it, and it was very similar. And she said, you're looking at someone who has the ability to save your life, but what we're looking at. And this is the stuff. It's like this is how people get sick.
yeah.
And we can change that.
And it's just so simple. Like,
Yes.
I mean, we're testing makeup in labs on
Right.
animals, which is disgusting.
Right.
Like, you can't swab something and send it in for an analysis. Like this, and it works. This is not like a Theranos situation or
Right.
anything
Right.
where we're
This
like
is real
lying about it.
science.
Yeah. This is like real science. It really works. And that's just absolutely baffling to me.
It
And
is.
especially because you mentioned like your husband was adopted, and so you
Yep.
wanted to get a fuller picture of everything that she's going through. I
Right.
mean, there are so many people who are adopted or orphaned or in this world. Like, I'm not just talking about the United States, and like the things that they might never know if they were so little, like a lot
Right.
of people don't keep that documentation, or like my parents are super hush hush on things where I have to be like, I don't know if anybody in my family has cancer. Like, let me call and ask. And they're like looking at me, and I'm like, yeah, there's no emotional EQ in my family. I'm
Yeah.
like,
Yeah. Yeah.
I don't know. So I'm like, I'm gonna
Yeah.
have to call and ask my parents if my grandparents had anything like different that I should probably know about for like my own health care.
Right.
It's just
Right.
absolutely amazing. But when it comes down to like having people who are adopted and like the fueling of wanting to make sure that your daughter's health challenges and like undercovering any, insights from that, like how do you feel this fueled your passion for this?
Oh my gosh, it was everything. It definitely changed my trajectory of this is where I'm headed. I'm funneling into this and this is where I'm going because it was personal to me
Mhm.
and it is something that literally changes people's lives for the better. That's that's beyond powerful. That's the reward right there. I'll give an adoption story of a at the time she was 4 and she was in the foster system. She was born with neonatal alcohol syndrome. So mom was addicted. She had amphetamine. She had coke in her system. So did the baby. She coded 3 times in the hospital. Her life was an uphill battle from the moment she arrived in the world. And now she was in school and she was already kicked out of her third preschool. And her moms actually came to us and said, okay, we need help here. And they had 2
Yeah.
biological children. And the biological children was saying, like, hey, she's a bit much. It's upsetting at home. Her behavior was just extreme. So they did the lab testing with us. She is in Florida. Her test scores, so an independent source, you're just looking at the academic piece of this. Her reading comprehension and her math scores went from here to here.
Oh my,
Unbelievable. Beginning of the year, end of year. I actually used this study to present in Abu Dhabi at the international conference. And I mean, that part alone is like, whoa, this kid's life is going to be so much better. But beyond that, Rachel, this is the part that still gives me goosebumps, is at the end of the year, she got the character award at school.
Love that.
She had changed so much. And you think about, for she's now 8 years old, you think about this child and how many people she is going to meet and affect in a positive way versus what she would have been,
No,
right?
1000%. And it's just so simple that you're like, I don't
Yeah,
understand. I just don't understand when healthcare, systems are like, no, we're not going to do this. Do they give a reason or are they just like, no, it's not,
we don't cover that.
that's not a reason. Like,
Yep. The
that's
denial. We
obnoxious.
don't cover that. Yeah. Yeah.
Held up by a man, an
Yeah.
answer. So like run around the bush there a little bit, but
Yeah. Just it's insanity because if all they're looking at is the bottom line, your bottom line is going to be better because you're going to prevent where you would have spent hundreds of thousands of dollars.
yeah, 1000%. And if people, have because it's not covered really by insurance, have the privilege to be able to utilize this service, like how, is it privately done? Do like general hospitals have this service? Where do
So
you?
it's privately done.
Okay.
We are now training different areas of healthcare, therapists, counselors, psychologists, people like that to say like you're getting results that are positive, but this could be on steroids
Yeah.
if you added this piece to it. So we're having to do that on our own to get out there and do those things
Yeah.
because believe it or not, the institutions are the ones who are running away from us.
And
They really
yeah,
don't want to see people with the results that we can give them.
I
Shameful.
literally shameful. Like that's so sad. And I mean, this is your life's work and like everything that you're doing. So what's your vision for a world where genome mapping is standard practice?
Sure. So people often ask me that question, and I'm like, just like a CBC, a complete blood count, when you go for your yearly, let's draw some blood. And what are you seeing? White blood cells, red blood cells. We're seeing if there's any huge red flag coming out of a disease. Otherwise, it's not really telling us all that much.
Yeah.
This is a one-time test. Your DNA is your DNA. What changes is the expression. So to me, I see this in the future as that this is one of the things that we do. We're going to do this test, and now we know how you're going to be treated throughout your life.
Well, I think it would also help for like you said about the little girl, it would help in education. It would
Oh
help in
my
like their
gosh.
learning streams.
Yeah.
There's so many different points that this could go through someone's life. And I mean, I remember millennial here back in school, like you literally went in the beginning of the school year and you got your vaccinations in the
In
school,
school.
in the
Yep.
bathroom from a
We do too.
rando nurse. Like now that I think about it, I'm like, I don't know how sanitary that was, but like it's whatever. Okay, we're past it. They did scoliosis testing.
Yep. In
The hell is
school.
that gonna do? What are you
Yep.
gonna do? Fix
Yep.
my spine? Like, are you paying for this? Like, super confused about that. But why are we not just being like, hey, okay, yeah, if you're showing signs at like 3 or 4, but like the minute you go into school, so 5 years old, like they get tested.
Right.
Like if you don't, or if you're worried, I know a lot of parents, like new parents especially, are just like, I don't want to do that to my kid, or like, oh, so yeah, give it a little bit. You have a second one, and you're like, I'm
Absolutely.
free, burn things.
Absolutely.
So being able to just do that from school would be like my
Right.
vision for it, to be like
Right.
every kid,
Right.
a global requirement. Like the UN should be on this, and like
Totally.
health
Totally.
organization and so many other people should, like organizations and like the big wigs of this should be on this and being like,
Yeah.
this could affect, like, especially for kids that are in like emerging markets, third world countries. We're
Hmm.
supposed to call them emerging markets now, but like India, a lot of the countries in the Middle East, Africa. I
Yep.
mean, the things that they don't test for. I also think that their immune systems are insanely better. Like I get sick every time I go there because I'm like sad American white girl.
Yeah. Yeah.
I'm like, they're drinking the water, and I'm like, I can't eat any of this. I will, I will die.
Right. Right.
So
Right.
their immune systems are so much better, but there's got to be things that don't affect obviously us in the States that are affecting them. Like if I drank the water, I'd have cholera. They're just living life.
Exactly. Exactly. Their bodies have adapted to it. and the why, that's what we look at, the why. I'll use an example to your point of a young person, how can guide them through choices they're going to make. Mom came to us, child, not really a child anymore. She was 19 and she's like, for 18 years, I have never seen this behavior in my daughter. It's like she came home from college. I'm like, who is this kid? Okay, your mom, DNA was always the same, but she didn't have the same stressors in her life to turn those genes on. And I said, so tell me what happened between 18 and 19. She went off to college. She's making her own decisions for the first time. She's trying to do school and hold down a part-time job. She's probably really not sleeping because she wants to do a couple parties in college that everybody wants to do.
Yeah.
Probably not eating well. And she's got all new friends. I'm like, okay, so her entire environment has changed. Those genes that were always there, the expression of those genes has now changed. They are turned on. They weren't before. And it was like, whoa, this makes so much sense. I'm like, so here's the plan of how we're going to do what we need to do to get her back to the kid that you knew and be in this world. And that information is so important for someone to know. We still all have free will. We still all get to make the choices we want to make. But you can do a double think of like when the kids are like, hey, here's what we're all going to do after school. Probably not a good idea for you because when they say the next day, like, oh, we're doing something different, you're like, no, let's do that again. I really like that.
I mean, and I love that story because it says like things come on later at the age, but like it's been in you
Exactly.
so long for
Yeah.
forever.
Yeah. All these new stressors say, hey, genes, we were always in you, but now we're going to show you.
Ugh, the life of stress. I love that. Do you have any tips on advocating for yourself, like in the healthcare system, and like what questions we should be asking?
Oh my gosh. Great question. Because just this week had a patient who has been on seizure medication for 25 years. She hasn't had a seizure in 6 of those last years. She is now 26 years old. Yeah, 26 years old. And in that, we had a first kind of, she's like, so I was referred to you. Here's what's going on with
Yeah.
me. Can you explain? So I said, well, with seizures, it's, what comes into play here is glutamate, which is a primary excitatory neurotransmitter. And that needs to be measured. So we know if this is what's happening, but all the literature tells us, and she's like, and I'm talking and talking. And I said, does any of this make sense? She said, I'm just silent because why have I never heard of that word or never been told any of this? And I've been literally living on this medication.
Yeah.
She goes, I'm just like, I can't even comprehend how come I was never told. So we start the process. She's like, can you send me any literature so I can show my mom? I said, sure. Right after the appointment, sent her 3 NIH studies. Here's the, how all this works. And she's like, this is unbelievable. So she does it. She had an appointment with a neurologist and said, can you tell me why we've never had this conversation? She said, neurologist was just silent. So advocating for yourself, knowing what's out there, knowing what's the latest science and saying, hey, why not me? Don't I deserve the latest science? And having that conversation. And not that the doctors are trying to be bad guys. They're not. The system is not set up
No,
for
for
them
them
to
to
think.
win. Yeah. But for them to even win, they're just
Yeah.
like, no, unless
Yeah.
you're, can you afford it? Then like, they're not donating
Yeah,
it.
it's like paperwork, 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 next, paperwork, paperwork. And you really don't have time to put into a relationship with your patient to know everything that you need to know. I mean, our intake is 12 pages long for a reason. I want to know everything that's gone on in your life.
That's insanity.
Yeah.
Literally pure insanity. This has been such an enlightening and amazing talk, and I want to say thank you so much for coming on. I have one final question that I ask to all of my guests, but if you could give one piece of advice to your 16-year-old self, what would that be?
Good question. Um, Practice gratitude, learn it early in your life. because gratitude can get you over the hardest parts of your life that you are going to encounter as you move forward. And when you, at that moment, we don't see what, okay, what's the good that's going to come out of this? It may be because this is an incredible opportunity that you would have never had whatever happened to you happen. So gratitude, what it does is allows our mind to shift and see what's right in the world instead of what's wrong in your world. You then start thinking that way. You bring that to the world. You present yourself that way, and life starts to change.
And that's amazing. Like, what a great piece of advice. I feel like, especially when you're a kid, you're just like, I'm
Absolutely.
happy for my
Yeah,
bar,
exactly.
my
Exactly.
iPod. Like they have those now. My
Yeah,
phones. Like priorities are a little different, but like growing into that and like having that skill set, like making it part of like a permanent habit in your life can only be so beneficial.
exactly. Exactly. The world is going to continue to spin with or without you. How do you want to play it?
So tell the listeners where they can find you, plug
Sure.
yourself. Like,
Sure. So our websites are wiredbiohealth.com or wiredforaddiction.com, either one of those. Go to the website, peruse, learn, read, and we even offer 15-minute complimentary consultations to see what's going on with you. Let's hear, what have you done so far? Is anything that we do beneficial or point you in a different direction?
I love that. And I think everyone, if you have the privilege to be able to do this, like the gift that you could be giving to yourself and your family, because we should all be, especially in today's day and age, prioritizing not only our health, but our families and like doing what we can. And this could be such an amazing source to be able to really get to the, like, get ahead of things. So I would highly
Absolutely.
recommend it. And I'm super excited to hopefully see what happens with the insurances and, people getting decent and making
Yeah.
this a standard.
Absolutely. And thank you, Rachel, for doing your podcast because this really opens up conversations to people that otherwise may never have them. Like you talking about your family. It's like, pulling teeth and let me go. I didn't have that information. So I said, how can I get
Yeah.
that information? Right.
Especially
So
for
thank
like millennials, parents are like, it was a long time ago. Everyone's fine. And you're like, but this also affects me, guys.
Right, right.
Here. And they're like, all in their thing. So, like, I'm totally going to be practicing this and getting genome mapped. I think this would be such a success, especially if I ever have kids to have
Absolutely.
an
Yeah.
idea and keep
Yeah.
going. So, highly, highly recommend. But thank you again for being on. This was super enlightening, inspiring, and I'm excited for everybody to go forward with really good wellness this year.
Thank you, Rachel. I appreciate you.
See you next week, everyone.